pose breathing for pelvic floor relaxation with an emphasis on internal rotation of the hips. So the goal of this is we're bringing our knees in and feet wide, gonna help send that breath, open up the posterior back of the pelvic floor. So you should feel that maybe a little bit more in this position. So basically we're going into child's pose, but we're just changing the angle of our hips here to open up a little bit more into that back of the pelvic floor. So I just have some pillows just to kind of rest here. So your typical child's pose is here. What I'm gonna have you do is bring your feet out slightly, and then you can just support yourself here on pillows. If you need more, grab a few more to help you relax. So if you can't relax here, then grab a few more to bolster yourself up a little bit higher, okay? And then the goal here is on each inhale and exhale, sending that breath into the pelvis, feeling that pelvic floor lengthen and release. So we're not doing any contracting or lifting here, we're just focusing on releasing the pelvic floor muscles. So really try to visualize the pelvic floor muscles lengthening and opening. You can visualize a flower blossoming and blooming open as those muscles descend and lengthen. And then try to keep the flower open and released as you exhale. So all about that lengthening and releasing here, okay? So inhale, exhale, so again, feeling the pelvic floor muscles that sit from your sit bone, so from butt bone to butt bone, they sit in there from side to side, and they sit from pubic bone to tailbone. So all around those openings, that is where your pelvic floor muscles are. So visualize those muscles kind of dropping gently and lengthening. So think of it as like a gentle bulge. We don't want to bear down and push those muscles down, but a gentle lengthening and opening of those muscles on your inhale and your exhale for this exercise. So really trying to get that breath into the back part of the pelvic floor can help with tightness in that area. Sometimes that presents as symptoms of chronic constipation, just difficulty emptying your bowels, or tailbone pain, painful sex, things like that. So this can be really helpful to try to get some air and get your breath down to that back part of the pelvic floor to help those muscles release a little bit and not hold so much tension.